5 minutes for questions, please.
Thank you, Mr. Chairman, and thank both of you for being here. I really do appreciate it. And Mr. Chairman, I want to thank you and the ranking member for introducing this reauthorization. It is critical, particularly to us in the state of Georgia. I served in the Georgia State Legislature on the Health and Human Services Committee, and I'm well aware of the shortages that we struggle with in the state of Georgia, particularly with physicians, particularly with pediatricians. Right now in the state of Georgia, we've got 130 out of the 159 counties that we have in the state. 130 of them are considered healthcare professional shortage areas. And in fact, out of the 159 counties that we have in the state of Georgia, 61 don't even have a pediatrician. 61 counties in the state of Georgia do not have a single pediatrician. Now, and a lot of those counties are in my district, and a lot of them are in South Georgia because of the rural area there. So it's really a challenge, and that's why this legislation is so important. That's why I'm a co-sponsor on it and why I appreciate it so much. You know, the Georgia Board of Physician Workforce estimated that the population of Georgia between the years 2000 and 2015 increased by 24%, yet we only increased the number of physicians by 9.4%. So obviously we're losing ground there. And one of the things that we really struggle with is the residencies, and that's one of the things that I wanted to ask you about. What can we do? I know that states like Georgia and Texas, because of the formula that's in place, we're not getting the number of residents that we need because it hasn't been updated in a while. You care to comment on that, Dr. Gerlach?
From our standpoint, from the academy standpoint and from the GME standpoint nationally, we are really struggling with the caps that were put in place so many years ago.
They were put in place when, 1996?
Yes, whatever number.
And they haven't been updated since then?
Correct, even though there's many more medical students and populations have increased so drastically. And the level of care, fortunately, since there's so much more in children's survivorship, we have many, many children with a great many needs, especially special health care needs, that we're not having enough physicians, enough pediatricians to care for them.
That's you know, I assume it's a responsibility, and I am assuming here this is a responsibility of the agency to update that formula, or is it a responsibility of Congress? Do either of you know? I don't either, Mr. Chairman.
I'm not aware.
I would ask.
It actually was changed during the passage of the Affordable Care Act, but I can't tell you the precise numbers. It is something we have under active surveillance on the subcommittee level.
Well, I apologize. I'm just not educated in who had responsibility over that. What do you think would be the best way for us to bring the slot allocation into up to date without harming other states? Is there a way we could do that without really causing any pain to other states? Yeah, increased funding, right? All across the board.
Increased
funding. Yeah, I stepped right in the middle of that. Yeah,
because you can't damage other
Strike
people.
that last question. I want to talk specifically about in Georgia, again, that's what I represent, and the Children's Healthcare of Atlanta. It's the largest pediatric residency training center that we have, and because of the CHGME funding, they are able to train more than 600 residents and fellows each year. And the majority come from state schools, so the majority of them stay. I mean, we knew that. We found that out during the time I was serving in the legislature. If you can get them to do their residency in the state, usually they'll stay. That's why it's so important. And we actually funded in the state of Georgia a number of residency, a number of slots for that specific purpose, to increase the number of physicians. But I just wanted to ask you, are there certain challenges to Children's Hospital in particular whenever you have and whenever you have this in place? Are there certain challenges that maybe you don't find in other areas, if it's just specifically for a children's hospital?
If I understand your question correctly, it's in order to get people to do training with kids, they have to want to deal with kids, and not everybody wants to. So you're starting with a specific personality, I think, that want to do that. Getting them to come, I agree with you 100%. If you want to, get more pediatricians for Georgia, the best way to do it is to get people into pediatrics from Georgia, and they're likely to stay there. But, you know, it's also a maldistribution of people within Georgia. You know, they're going to stay in Atlanta and not go to the other parts.
Absolutely. That's why the 61
Right.
are mainly in South Georgia.
Right. And so that becomes difficult then as well. You know, I recruit pediatricians for our clinics in Africa. It is, and I used to work in Arkansas. It's a lot easier to get people to go to Africa to work than it is to go to the Mississippi River Delta. And somehow it's, you know, an adventure when you go to Africa, not so much when you go to the Mississippi River Delta. But people there are just as poor as the people we treat in Africa, et cetera. So this maldistribution is something that we need to address as educators and healthcare providers as well. And maybe it requires incentives to get people to go to those places as well. Loan repayment, other kind of things.
I know I'm way over my time. Just what are your suggestions? How can we improve this situation?
As you said, the loan repayment is a huge incentive, especially with the incredible debt that everybody has nowadays. That's probably the most straightforward way to do it.
Right.
Good.
Very well. The
And I
gentleman's,
yield back. Thank you, Mr.
gentleman's
Chairman.
time has expired. Chair would recognize the gentleman